Okay, so the question of how often should we vaccinate any animal in general? It depends on the disease. Okay, so even right now, the vaccine companies for the 3 core viruses like distemper hepatitis virus, they're actually licensed for 3 years. So that is what they recommend, vaccinating every 3 years. Okay, things like leptospirosis, the bacteria, not the virus, is usually every year. So there lies the difference. Duration of immunity depends on the individual as well. So as we know, it's some disease, it all depends on the individual. If the individual is immunocompromised, then the need for vaccination may increase. How vaccination works is that the substance or the vaccine is injected into the animal and the animal mounts a response to it. Okay, so for say distemper hepatitis and parvovirus, they mount a response and the memory cells still stay present in those cases up to 3 years, as recommended by the vaccination company, which is why they only recommend vaccination every 3 years, because after they've shown that there is enough memory cells inside there, should the animal contract the disease or be challenged with that particular condition, the memory cells are present enough to hold it at bay. Whereas our leptospirosis is a bacteria, so the memory cells isn't that good. Hence, we vaccinate leptospirosis on a yearly basis, just because purely the immunity, because it is a bacteria and not a virus, just simply does not last. Same for kennel cough as well. So vaccination for kennel cough is recommended for every year. Immunity is not lifelong. So there's been various sort of talks whether a one-off vaccine when they're puppies is just going to last forever. We can't really show that, we can't really prove that, and certainly with evidence it shows that it is certainly not lifelong. They do wane off after some time. The memory cells do sort of go down and not have that problem. So to be safe, vaccine companies, they quote a minimum duration, not a maximum. So this is where the difference is. Okay, so for vaccine companies, they quote a minimum duration, not the maximum. Whereas for the guidelines for WSAVA, they're talking about how long can we get away without doing it. A good analogy would be, without something random, tire changing. How often do we change our tires? Okay, so when we have a brand new tire fixed onto your car, the rubber is at the thickest, okay, which means that it is probably the safest. Your car is less likely to get punctured or or be punctured running over a short nail or anything like that. Okay, but how often do you change the tires? So some owners they change it whenever they think that it is worn down a little bit. Okay, and some owners they wait till the minimum legal requirement before they change it. So it's still talking about changing tires, but you can see by the approach and the objective of each tire changing, the approach changes. Okay, because if you really want to be extremely safe, you always want to have the thickest tire ever, which means that you should change it very, very often. If you just want to get by with the minimum requirement just to drive your car and not too concerned about safety, you want to stretch the interval of the tire changing to say save money, or just to make your tire last as long as possible. Does it make sense? Yeah. So annual vet visits also allow for full health assessment as well as an opportunity to top up immunity with vaccination if necessary. So this is quite, for me, it is quite important. Even if you're not talking about vaccinations, animals should be seen regularly, really, if not twice a year, similar to our dentist, just for a vet check. And certainly having vaccination does allow owner to be more sort of proactive in bringing the animals in. Okay, so we're going to discuss, do we need to vaccinate our senior pets? Some people, they ask a question, I've had my pet vaccinated since he was a puppy for the past 7, 8, 10 years, even 12 years. Now, it's 13, 14 years old. Do we need to keep on vaccinating it? Would they have built up an immunity over all this time to resist all the different infections that we are vaccinating against? So, some owners, they do misguidedly believe that vaccination in senior pets is not necessary. So it is a tricky question, okay, but nonetheless, it does have its own various beliefs, and I'm just going to share with you some of our understanding in vaccinating senior pets. Research suggests that senior pets have a less effective immune system than younger pets. So it's just like, for example, when we get older, we always talk about older people, in 60s, 70s, 80s, they can potentially be a little bit more vulnerable to sort of diseases that a younger person with more robust immune system may be sort of stronger against. We have all heard of people or older people who go into the hospital and contract all sorts of different diseases from the different condition that they were originally admitted for. So if we sort of think of that in that sort of context, then we can potentially argue that, say that because they are older, sometimes the immune system isn't as strong due to various reasons, if there's an underlying condition or whether there's organ issues and things like that, really. So you can sort of extrapolate that sort of reasons to pets as well. Certainly, this is not a blanket sort of a statement for all older people or older pets, because certainly there's some individuals who are very, very healthy, very strong, and it's not necessarily that all older animals or people would have necessarily a weaker immune system. But nonetheless, to say that they have a stronger immune system because they're older, that could be a little bit misguided, really. If the lifestyle changes, so it's quite different as well. So maybe it will reduce the number of diseases vaccinated against if the lifestyle for the individual has changed. Example, an elderly cat that does not go outside will not benefit from a feline leukemia virus, just like how an elderly dog that does his own little walks without meeting other sort of dogs of unknown vaccine origin would be less likely to get kennel cough, and certainly if they are not traveling overseas because they're older, then certainly things like rabies itself may not be necessary. There are a few sort of vaccination concerns that people may have to say, okay, I've heard of things that can happen when an animal is vaccinated. So this is a practice overview of canine health. It's called a Pooch study. It is a data from almost 4,000 dogs. It is commissioned by the Animal Health Trust that has got no affiliation with any of the vaccine companies. So it's not as though they sell vaccines or anything like that. So we like to think that it is as sort of fair as it potentially could be. So the conclusion from this particular Pooch studies is that there is no association between recent vaccination and ill health in dogs. And they also could not find any associations between the number of vaccinations received and ill health in dogs. So talking about the first one, so no association between recent vaccination and ill health in dogs. Just saying is that if there is a lot of dogs that come in for vaccinations, the proportion of dogs that actually have a negative effect from the vaccination is not significantly obvious to say that vaccination is not good for dogs in that respect. Sure, certainly there will be individuals that may have a sort of had side effects from the vaccinations, but it's not unlike somebody eating peanuts to say that just because a person has got adverse reactions to peanuts doesn't mean peanuts itself is poisonous and is definitely going to cause an effect to all people. For the second statement, to say no association between the number of vaccinations received, so they're saying that, okay, not just one vaccination, let's swallow 10 vaccinations over 10 years. And they found no association between the number of vaccinations received and ill health in dogs as well. So a dog that is 12 years old that has received maybe 11 or 12 vaccinations is not in any more risk to be ill compared to a dog that's received less vaccinations or no vaccinations at all. So this is the Pooch study that they had from the Animal Health Trust. So, but are there actually reactions? So if you find in each vaccination pack, okay, there's always instructions to say that vaccination reactions are rare, but the most common reactions are mild and consist of vaccine-related injection lumps, fevers, and loss of appetite. So firstly, it is fairly important for us to be vaccinating healthy animals to start off with in the first place, which is why you tend to always have a vet check rather than just randomly vaccinating a dog, especially if it's not well, okay? Having said that, even in the most sort of healthy animals, there's a potential reaction that may happen. So when we say something is rare, usually it's sort of a 1 in 1,000, okay? And the most common reactions are mild and consist of vaccine-related symptoms, as what's written over there, not unlike a child vaccine. So serious reactions are very rare, but may consist of allergic anaphylactic reactions and autoimmune conditions. So when they say something is very rare, we're talking about 1 in 10,000, okay? But they may sort of consist of those slightly more serious clinical signs. So the suspected adverse reaction incidence is 0.004%, which means that we're talking about, you know, sort of 10,000 animals, maybe 4 of them would have a reaction to vaccination. So in many cases, the benefit of protecting your pet from those life-threatening infections far outweighs the risk of adverse reactions. It is quite important to understand that the choice of vaccination lies with the pet owner, yourself. So any sort of vaccination, any sort of medication in general, we always want to have a benefit-risk analysis ratio. What is the benefits I'm getting out of this, and what is the risk that potentially happen? That sounds pretty much in what we do in life. Whatever choice we make, we want to weigh the pros and cons. So that is one of those things whereby it is the owner's responsibility to make sure that you know exactly what you're doing and why you're doing it, and accept the risk that's involved. But that is the sort of generalized advice that most vets would give, to say that the benefit of protecting your pet from life-threatening infectious far outweighs the risk of the adverse reactions, considering that the adverse reactions is quite low. Not zero, but low.